Hello, everyone. I'm Molly Hadfield, the Media Relations Director for the City of Topeka and part of the Shawnee County COVID Task Force team. Welcome to our weekly press conference. We are going to hold questions until the end. Today, we're only going to have 4 speakers, and we are going to start off with Dusty Nichols and an update with emergency management.
Good afternoon, everyone. I have a very short presentation like I usually do with the slides, just kind of catching everybody up with what we've got done the past week as far as resources. What you see here is those resources being delivered. We continue to add 1 or 2 per week. These slides can be available. I'll send them to Molly afterwards, and she can send them out if you request them. There's the resources delivered. The resource requests have slowed down a little bit since we've opened up, started opening up the county, but you'll see that some of the numbers have gone up. We continue to monitor all COVID related issues across the board, specifically health and how they relate to the opening of the county. We are monitoring all the threats, not just the COVID specific thing, but the things surrounding that as well, potential threats and risks. Continue to clarify the ASHA, the state's opening plan, and clarifying those things with the state that need clarified and answering those questions. And we continue to work with the recovery team, passing on information as needed to for the planning purposes moving forward, and other partners as well, school districts, our faith community leagues, the arts community, and those other businesses trying to open up in the future, trying to give them guidance and to make those best decisions. And then starting to look this next week, I'll be focusing on phase 2, if we're allowed to go there, doing the same thing, and hopefully we can get a little bit further in front of what's been happening as far as the clarifications. I'll continue to issue out any clarification or addendums at noon daily if they're needed. And you can still contact me at any time. There's questions or anything that needs clarified. So that's all I have today. Thank you.
Thank you, Dusty. Next, we'll have Craig Barnes giving an update from the Shawnee County Health Department.
All right, thank you, Molly. Going to share my screen here real quick and just a quick update for you all as usual. Today, I'll do a status update with the dashboard. Again, as a reminder, these are point in time reports, and these are all based on individuals being reported and as we receive the cases. So as they're confirmed and received by the Shawnee County Health Department. So today, as report, we are up to 149 confirmed cases with 3,713 individuals being tested. We also today did hit 100 full recoveries from COVID-19 here in Shawnee County of Shawnee County residents. Again, just as a reminder, individuals can come down to see the summary of community impacts to kind of get a little bit of a trend line to see the confirmed, active, as well as recoveries here in Shawnee County to kind of get a little bit more historical impact on what we're looking at here in the community. From there, I'll go ahead and leave the dashboard up, but we did have been fielding a couple of questions over the last week regarding testing. So we wanted to go ahead and take a moment to answer a couple of those questions. So right now, the Shawnee County Health Department is not currently conducting any testing of its own. But we are in the process of developing some plans for drive-through testing site to focus on uninsured individuals here in our community in the near future. So we will have some more information on that in the coming week. Right now, you do have 3 testing options in the community if you have 2 or more symptoms of COVID-19. So that would be like a fever of 100.4, a cough, headache, sore throat, chills, any of those symptoms. Those 3 options are to contact first your primary care physician and see if they are able to or willing to test you at their facility. You can also call Stormont Vale Health. Their phone number is 785-354-6000, or the University of Kansas Health System St. Francis campus. They can be reached at 833-463-9362. Both health systems here in our community, Stormville Health and St. Francis campus, also have an online portal where you can do a self-reporting and self-screening. You can go through those to see if you're eligible for the testing. If so, they will again prompt you to call those numbers. I think, again, it is important for anybody who is interested in receiving testing to remember to call ahead to any facility that they are going to make sure that they are following the proper protocols for that facility for the COVID-19 testing. Additionally, the other question that we've been getting a lot this last week is individuals who are calling the health department for their test results. A couple of things that we want to point out here. Test results do vary depending on what lab is analyzing those results. So it does take sometimes a few days to get those test results. But also it's important to note that if an individual is looking for their test results, whether positive or negative, they should contact the facility and where their testing was completed to receive those results themselves. The health department will not be releasing those. We might not have that specific information. And so we are prompting individuals to call the facility where they were tested to receive those results. And then lastly, just a reminder from the health department to everybody, the media and the public, to practice good social distancing measures. So that would include maintaining a limit of no more than 10 individuals to a group at this time, keeping 6-foot distance between individuals when possible, and wearing a mask in public when able to, as well as general hygiene measures such as washing your hands, avoiding contact with eyes, nose, and mouth, as well as avoiding close contact with any individuals who are sick. So with that, I will stop my screen and turn it back over to Molly. Thank you very much.
Thank you, Craig. Next, we'll get an update from Dr. Pizzino.
Good afternoon, everyone. As probably most of you remember, we ended last week on a sober note with the second highest number of cases ever reported in Shawnee County. That was while we were still under a lockdown, or safer at home, as we like to call it here, county order. And right before we were on the verge of lifting some of those measures. It is Friday now, and while the week is not over, I can tell you that we are likely to end the week just about at the same level as we were last week. So it hasn't gotten any better and it hasn't gotten any worse. So I'm not sure what you want to make of this. It was pretty bad last week and it's still pretty bad now. But the worst part last week was that there was a sharp increase over the week before. We haven't seen the sharp increase this week again. So at least we are on the same level as last week. The other thing that we have not seen this week is a high number of cases with an unknown source of infection. So most cases, the vast majority of cases we have received in this week, we know where they got it. Or at least we know that they are associated with the cluster of other cases they share, either working at the same place or being part of a correctional facility where we have cases already reported and things like that. As I mentioned many times, one thing that concerns me is when I see too many cases popping up in the community and we have no idea where they're coming from. That's something we have not seen this week. We have seen at least 3 more hospitalizations, and our data, our records are still incomplete for the week. Of course, the week is not over yet, but also for the previous few days. And that's something to keep in mind. So the more we learn about this disease, the more we learn that most cases are going to be mild, but some are not, and some will end up in a hospital. And some will die. And if you look at the national figures, it's shocking to me how quickly the number of deaths is climbing. It wasn't long ago that we were saying maybe we may have as many as 60,000 people dying for this pandemic in the country. And now we are already at 67,000. And it's still going up, and we still go up considerably. And some projections are now for more than 120,000. Make no mistake, this is a deadly disease. When people like to compare this to the flu, there is no flu season. that will kill that many people on an ordinary basis, unless you go back to big flu pandemics. It's just a different order of magnitude. What we said at the beginning that could happen, which was a high level of people sick, high number of people sick, a high number of people dying because everybody is susceptible. This is a novel, a new virus, is happening. And so I want everybody to reflect on this. Just because our hospital beds are relatively empty, it doesn't mean that this virus is gone away. It doesn't even mean that we are bringing the virus back in its own box. It simply means that we have ICU beds available for those who are going to need it. And I would argue that that may not be the best approach we want to take as a community and as a society. Don't worry too much. If you get coronavirus, we have an ICU bed for you. That's certainly not the approach I want to take as the health officer for this community. We have a couple of clusters of cases that we are investigating, and we have investigated here in Shawnee County that are related to some retail businesses. Typically, we do not release that information unless there is a reason for the public to know. In the first case, there was no reason for the public to know, and we are not releasing where the establishment is. In the second case, actually, there is a reason for the public to know. And so we released a press release. We issued a press release yesterday to alert people who stopped at the Turnpike station just east of Topeka in the food area or visited the restrooms in the past 14 days. If they get sick, they should alert their physician that they may have been exposed to coronavirus. Now, this is not a call for everybody who was there to be tested. It's just an alert that if people get sick, they should alert their physician that they may have been exposed to coronavirus. And then the physician can certainly contact the health department, or they can decide on their own how to handle that case. But again, it's a reminder of how easily transmitted this virus is. And let me just give you an anecdotal story, and I'm trying to think of a way I can release this without compromising any confidentiality. I think I can do that. One of the cases we identified, one of the people, infected people we identified this week, is an elderly person who did all the right things. This person was elderly, stayed at home. Most of the time, this person went out. Apparently, according to this person's report, we have no reason to doubt it, only twice in the past 14 days to visit 2 department stores in town, once for groceries and one for essential items that this person needed, and yet tested positive. And now the spouse of this person is also sick, and we suspect that the spouse may also be positive. This person was shocked when learned about the result, because this person really thought that they were doing all the right thing, and they were, and yet they got the infection. Is this one of those who's going to end up in a hospital or in ICU or on a ventilator? I don't know. Could be. But the point is, this is a very dangerous virus. Just because most people can get away with that without serious symptoms, the ease with which it spread and the enormous number of people that are infected in our community, of which we are just identifying the tip of the iceberg. Make no mistake, the number of people we identify through lab testing is still just a fraction of those that are infected out there. All these factors make this pandemic a public health emergency. And the public health emergency has not left just because we decided it was time to get out of our homes. So 2 things I want to tell everybody. First of all, please slow down. I know there is a lot of impatience out there. I know that people want to get out. I know that businesses want to reopen. I know that people are trying to find a way to just stretch everything they can in the governor's order that was also adopted by Shawnee County to just try to push in maybe one little exception where the language may not be exactly clear, and we use that as a loophole to decide that we can do this or that. This is not the time to do that. Our numbers do not support an approach even close to that. The numbers in Shawnee County are not improving. And mind it, this is before we can monitor or we can measure any impact that may have resulted from lifting the safer at home order this week. Because the numbers of cases that you see today is the reflection of what happened 10 or 15 days ago, not what happened this week. The result of the changes that we made this week will be known next week. Which brings us to the second point I wanted to make. So the first is please slow down and take this order seriously. Take it slowly. It's not time to rush out and celebrate a pandemic that has gone away, because it's not gone away. The second point I want to make is I know that at the end of, well, first of all, next week, nothing will change. And I told you last week, we will reassess this after a week. We are not going to wait 2 weeks. We're going to assess after a week and see if there are additional measures we need to bring back. If the curve of cases had still gone up and double, essentially, as it did from the week before. So that's what happened last week, right? The end of last week, we had twice as many cases as the week before. If at the end of this week, we had twice as many cases as last week, I would be here now, today, to tell you we need to do something stricter. That's not the case. We are still at the same level as last week. It's not a reason for celebration, because that's too high a level at this point in the pandemic. We are still too high, but it's not enough to say that we need to bring back some of the measures next week. So we're going to wait for the 14 days that phase one goes through. And then at the end of next week, we will reassess it. The point I want to make is there is absolutely no guarantee that we will be able to move from phase one to phase two as in the governor's plan. And that means exactly what those words sound. There is absolutely no guarantee, which means I don't know. I don't know if it's going to happen, and I don't know if it's not going to happen. So if you're a business owner, you're making plans, if you're ready to reopen the week after next, please be flexible, have flexible plans, and please understand that you will not know if we are going to move into phase two until this time on Friday evening next week. And if you are a current business owner, if you are a restaurant owner who just reopened his or her restaurant, please be aware that there is no guarantee that we can keep the same situation in place as we have now if our cases continue to increase, or our number of hospitalizations increase, or the number of cases that we identified for which there is no known source is going to increase. Final point I want to make, there is a price, there is a cost in having this number of cases, even though most people in our community do not see that. And that's the cost for our public health nurses to investigate each and every single one of them and their contacts. Today alone, we had about 10 cases reported. Within minutes, I'm not kidding you, within minutes, I had an email from one of our nurses to tell me the story behind each of those cases. That's how good they are. And yet there is a toll that they're paying. These are hours and hours and hours of work. Those 2 clusters of cases that we just had this week, nobody has any idea except for the people involved in that investigation, how much work it took to investigate them. And now to find all the contacts, and now to test all the other people, all the other employees of those businesses that need to be tested. So even though that happens behind the scene, there is a cost that we are paying. Most public health services the health department was able to offer up until a couple of months ago have been scaled down or even suspended altogether. This situation cannot continue like this forever. We've got to bring those numbers down one way or another. And we've got to find a way to do it with the minimal, as small an impact on our economy and our social networks as we can. But the solution is not to just reopen everything and watch while the number of cases goes up. Our public health nurses work themselves out, and finally, almost to the point of rupture or breaking down, or maybe at some point quitting. Frankly, I'm surprised that some of them haven't quit yet. And the reason is because they're very dedicated people. They know that's what they signed up for, and that's what they're doing. But this is not sustainable. We cannot continue to have 20 or 30 cases of coronavirus that we need to investigate every week. Okay, I'm going to stop here. Thank you.
Thank you, Dr. Pizzino. Next, we will have an update from Mayor de la Isla.
Hi, everybody. I have in the background the awesome things that were developed by the Greater Topeka Partnership. Want to give them a huge shout out. And if you notice, I am wearing my mask behind the message that says, be safe, be smart, and support our recovery. And I think that it's extremely important that we see that you can show your personality with your masks. I think that you guys know that I am a huge fan of Wonder Woman, and my great friend Sky made me a mask. And I want to invite everybody that's watching to make sure that you are using your mask so that you can support our recovery. I think Dr. Pizzino made some pretty salient points with regards to the fact that in order for us to continue looking at our community and the way that we're moving forward, that we understand that we have to make a personal risk assessment, and most importantly, the act of kindness of protecting yourself with a mask that you could use to show your personality with as you're going out there. So please, 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 if you're out there, wear your mask. For the first time, I actually went out in the community on Sunday. I was working in my yard, and I went to pick up some materials in 2 local hardware stores as I was looking for plants and looking for things to do in the back. And it was impressing to me to see how many people were out there without their masks, and how many people were in both stores not keeping that 6-foot distance from each other. So remember, this is pretty cool. So make sure that you find a mask that you enjoy using, but make sure that you use your mask. So without further ado, I'll go into a really quick translation of what was said today. El señor Dusty Nichols estaba hablando sobre al mediodía, de ahora en adelante, si hay cambios en la regulación que la gobernadora Kelly ha mandado, al mediodía nos va a mandar esos cambios. En adición, estamos muy agradecidos de las iglesias y estamos agradecidos del equipo de recuperación que nos está ayudando para asegurar que tengamos la información que nos hace falta. El señor Craig habló sobre el dashboard que tenemos, que son los números que tenemos en el condado en estos momentos. Es importante notar que tenemos 44 casos activos. Quiere decir que de la semana pasada a ahora crecimos el número de la misma forma, lo cual indica que seguimos teniendo casos en la comunidad. Lo que nos da un poco de paz es saber que tenemos unos casos que sabemos de dónde esos casos vienen, ¿no? Así que es importante que sigamos manteniendo un récord de con quién nos hemos mantenido en contacto para que la gente sepa cómo identificar quién haya sido infectado. Solamente tenemos las 5 muertes que tenemos, pero tenemos 3 personas ahora mismo en el hospital. Así que tenemos que tener cuidado. Hemos hecho reapertura, pero tenemos que ser cuidadosos cuando estemos en la calle. Si tiene una fiebre de 100 grados o más, está tosiendo y dificultad respirando, por favor recuerde que no vaya al médico sin antes llamar. Si está yendo a un médico de cabecera, por favor llámelos primero, o antes de ir al hospital, llame al hospital. Recuerden que las reglas siguen siendo que no más de 10 personas en un lugar, y por favor mantengan 6 pies de distancia. Obviamente si son familia no hace tanta falta. El doctor Pizzino estaba hablando referente al caso de que tenemos, hicimos un anuncio recientemente. Si hay alguna tienda que hemos cerrado, típicamente no hacemos anuncio de que cerramos la tienda. Pero en esta ocasión, tuvimos una tienda que fue cerrada que sí hicimos pública, que fue que si en las últimas 2 semanas usted ha parado en la tienda o en el baño que está en el puesto de gasolina que está justamente fuera de Shawnee County, estamos pidiéndole que por favor que se comunique con el Departamento de Salud, porque hubo un caso y ese área del baño y los restaurantes en esa parada están cerrados. Tenemos varios casos, como dije, 3 casos en el hospital, y estamos verificando los números para ver dónde vamos a estar la semana próxima. Así que por favor mantengan muchísimo cuidado para asegurarnos que no tengamos más casos en la comunidad de los que necesitamos. El ejemplo que el doctor Pizzino compartió fue que en nuestra comunidad hubo una persona que es mayor de edad que quedó enferma solamente de haber ido al supermercado y a otro lugar. Que queremos que entiendan que este virus realmente sí es peligroso. Y por eso es que estoy enseñándole mi mascarilla. Es una mascarilla de la Mujer Maravilla. Aquí tiene a la mujer a la Mujer Maravilla en este lado. Y usen la mascarilla cuando vayan. Es muy importante que usen esto porque es un acto de bondad. Cuando usa su mascarilla, protege a las demás personas de que si usted tose o se enferma, entonces queda protegido, ¿no? Así que cuide a su vecino, cuide a las personas con las cuales está en contacto. Es importante que use la mascarilla y que se lave las manos lo más posible. Así que muchísimas gracias. Nosotros vamos a seguir en contacto con ustedes y cualquier cambio que haya, los veremos el viernes a las 4 o si no, los veremos antes. Muchísimas gracias.
Thank you, Mayor. We'll now open it up for questions. If anyone who wants to ask a question, click the raise hand icon next to your name in Zoom, and I will call on you and then tell me who you want to talk to, and then feel free to ask your question. So first up, we will have Sean Wheat.
All right, thank you very much. Really appreciate it. Dr. Pizzino or Craig or Linda, if you're on. The cases out at the Turnpike rest area just east of town, how many, I know you guys had said some cases, but how many cases can you say may have stemmed from that? And was it one incident of one person potentially spreading it through the bathroom, or could potentially several people? And is that considered a cluster site?
Let me give you a quick answer, and it's going to be quick because the short answer is that we really can't discuss too many details for confidentiality reasons. I can tell you that it's more than one case, otherwise we would not have done what we decided to do, and that these multiple cases were not connected to each other with the exception of working together in the same place, the same workplace. We don't know exactly how the infection was acquired by these individuals. And so we can tell you if it was through the restroom, if it was through the work area. The reason that we mentioned the restroom in our public alert is because the restrooms are shared between the staff and the public. And so since we have multiple cases that were related to the same work site and was not clear how those infections were acquired, there is a possibility that there is an environmental contamination there that could have affected also the bathrooms. And so that's why we issued that release, the press release. I think you know from the press release, the place was shut down and was doing a deep sanitation, after which time they will be able to reopen. And we identified co-workers of these people who needed to be quarantined, and these individuals will be placed on quarantine for 14 days. And I can't tell you exactly if this will count it as a cluster at the state level, because I'm not 100% sure how the state decides what's a cluster and what's not.
All right, it looks like Sean has another question.
When it comes to the retailers, and Dr. Pizzino, you talked about this a little bit. When somebody hears of a retailer potentially having an employee that has contracted the coronavirus or tested positive for that, do you guys automatically tell those retailers you need to go and have other employees tested? Because we know, again, El Torito had several employees that tested positive as well, and they've shut down. They're starting to clean up too. But I mean, is it the health department's telling them to go get tested, or do they have to actually go show symptoms, even if they may be asymptomatic?
Yeah, that's an excellent question, because it gives me an opportunity to briefly describe a little bit of a shift that's happening about testing, around testing right now. First of all, there is really no automatic. The word automatic in this situation really doesn't apply. Sometimes I wish it could, because it would make our lives much easier. But in fact, every situation is different. That's where having skilled public health professionals really is important, because we need to understand not just if we have 1, 2, 3, or 4 cases among the employees, but how are they connected? if can we find any connection where they all on the same shift, where they're all working out of the same department? Are there other connections outside of the workplace? So all those factors and other factors need to be taken into account before we can make some recommendations. So nothing is automatic. It goes back to the issue of what happens behind the scene that people really don't see day in and day out, is that it takes hours and hours for each of these events to be investigated in that way. But about testing, what we have done in the last week or so, we have started to test some asymptomatic individuals who had been exposed. And that's something new, because up until that time, primarily because of the shortage of testing kits, we were not able to do that. And we were only able to test symptomatic individuals. Let me clarify, the people without symptoms that were tested were people who had been exposed. They were co-workers of, in some businesses where more than one infected person had been confirmed. So typically what we would do with those coworkers would be to put them on quarantine for 14 days. And then if they develop symptoms, we test them, and then we do a contact investigation of those sick people if they turn out to be infected with coronavirus. We are sort of taking a shortcut here by testing some of those individuals even before symptoms, in the sense that we may be able to identify some people who are infected but are not showing symptoms yet. Probably most of them, or many of them at least, would show symptoms a few days later, but some of them may never show symptoms. We are learning more and more about the number of people who are infected with this virus and never show symptoms. And that's a big headache from the public health point of view, because we will never identify these people without testing. So by testing them early, we can identify them before they show symptoms, or sometimes we can identify them at all, because we wouldn't be able to identify them just with symptoms. And then we can start the contact investigation more quickly, and we can remove them from being in contact with other people more quickly, so that we decrease the exposure. However, the caveat is, for those who do not test positive and were exposed, the quarantine order still remains in place. And I know that that's disappointing. It's disappointing also for me. I wish I could say, well, they're negative, so they're not infected. That's not the way it works. The test does not detect infection. It detects whether there is virus in the back of the throat or nose of the person being tested. And that happens only several days after infection. But during the incubation period, the virus is not detected. So we are starting to utilize somewhat more aggressive techniques, which are made possible by, number one, our knowledge that's evolving, especially about asymptomatic people who shed the virus. And number two, a more broad availability of test kits, so we can use them also on some asymptomatic individuals. I hope that answered your question, Shaw. I know it's a very long answer to a question that was very short.
Okay, we have another question from Sean, and that'll be followed by Raina.
Well, Dr. Pizzino, I'm sure you've probably seen it, but there is that video that's been going around called Plandemic, and it's the doctor who was on there saying it's all planned, it's a hoax, conspiracy theories. What would you say to folks who are taking and watching those videos?
First of all, I have not watched the video. Better things to do these days. So I just heard about it. And as a matter of fact, I heard about that just a few hours ago. I didn't even know that video existed. And I think there is also a related book related to the video. What I would tell the people who are watching the video is that it's very easy to fabricate stories. And even though I have not watched the video, from reading the reports, it sounds like this is totally fabricated. What it means is that there is absolutely not a shred of evidence that the allegations in the video are true. There are no proofs. There is no supporting evidence whatsoever that I've read about, I've made aware of. I just hope that people understand that there is a danger in following those trends without being a little bit more inquisitive. Just because you see something on the internet, it doesn't make it true. Just because you see a video, it doesn't make it true. People can express all sorts of opinion. opinions. The opinions are just what the word means. They are opinions. They are not facts. The facts are that we have a virus. The facts are that we know that started in China, and we know that it's a novel virus and nobody has immunity against it. We do not have a vaccine, and that is taking hundreds of thousands of lives throughout the world. Those are facts. Those are facts. Now, if you get into the area of, I don't even believe the facts because the TV reports I'm watching are fabricated and they're, Photoshop fakes, then I'm afraid I have nothing else to tell you. We are just living in different dimensions and in different parallel worlds, and I just wish you the best of luck. But I can tell you I will do everything in my power to prevent you from hurting our community if you start exhibiting irresponsible behaviors that do not take into account the orders of public health authorities. Because your rights stop where you infringe on my rights to remain healthy. So you have the right to become sick and to inject yourself with coronavirus and to drink disinfectant if you want. You have the rights of doing all those things as long as they only affect your health. The moment your fist comes close to my nose, that's the rights of your fist stop point. And I'm very determined to make that happen, to draw the line.
All right, we have Raina followed by Sean and then India.
Yeah, Dr. Pizzino, now that we are entering the beginning phase of reopening, are you concerned, and you kind of touched on this earlier, that people will stop adhering to safety guidelines and recommendations and potentially causing a setback and preventing us from moving to that next phase?
Yes, I am concerned. I am concerned, and I was concerned already last week because that was already happening last week. I seen that, and I suspect that's why last week we saw twice as many cases the week before. It's human. I'm not judging people for wanting to get out, and in reality is that as bad as the pandemic is, we only have 140 something cases in the entire county. So most of us does not know directly a person who was either sick or died. And so when we ask the community to stay home, to give up their jobs, to not go into restaurants, to not do all the activities that people ordinarily would do, that's a big ask for something that they can't really see. That's why I think we need to keep talking about these things. We need to keep having these conversations. We need to keep disseminating the message that this virus is indeed taking lives away. And if you want to see how that can affect people directly, just go no further than New York City or New Jersey or Michigan or places where you have attack rates that are 10 times the order of magnitude as those here in Kansas. The reason we have been spared that worst case scenario here is because in part we were lucky in the sense that we are in the middle of the country. We are more sparsely populated. So they took a little bit longer for the virus to get here. And number two, we were able to learn from the experience of those unfortunate localities, especially on the East Coast and on the West Coast, that went ahead of us with this pandemic. And so we had more time to get ready, and we had more experience that we could use from those sites to get ready in the right way. So once again, it's the curse of public health. If we do a good job, bad things will happen less often, and then people don't understand why we need to be there. And they don't understand that the reason is because we are doing that work. The reason you are not seeing 500, 1,000 cases in Shawnee County is because we all stayed home for weeks and weeks. It doesn't say that it was unnecessary to stay home. So this is it's still not the time to relax our guard. I think people did relax their guard a little bit. Is that why we are having twice as many cases now? I was saying a moment ago, there is no strong evidence. I can tell you there is an evidence for that. But I have a strong suspicion that that played a role. People have been a little bit less careful in the last week or 10 days. And as a result, we see more cases. My concern is that we're going to see more cases next week. I hope I'm wrong. I'm not even predicting that we're going to see more cases, but I'm saying it is a possibility because this week, people have even more social mobility than the week before, since now we lifted that safer at home order. So yes, I am concerned, and I really hope that people are listening and understand, take it slowly. Let's take one step. It's not time after you get out of the box, out of your jail, because we were in jail essentially, more or less in our homes. It's not time now to start running away. Let's take a few steps at a time and see what happens as we take the steps. See if our legs can sustain it, if the community can sustain it, then we can take a little bit more steps before we all start running in all different directions.
All right, we've got Sean, followed by India, followed by Raina.
Dr. Pizzino, tomorrow there is another protest set for the State House to open up Kansas. You got a lot of people who, again, don't believe in what's going on with social distancing. They're getting really close. They're basically don't like how things are going. What would you say to those individuals who are going to be protesting tomorrow, some of these stay-at-home orders and these restrictions that are on counties they don't believe that they are correct to have in place?
Yeah, well, first of all, everybody has the right to express their beliefs and their opinions. I'm convinced of that. So it doesn't bother me that people want to express those opinions. People do not have the right to disobey laws that they don't like. Our society would turn into anarchy if everybody would follow only the laws that they like. That's not how law and order is established. Law and order means that there are people in charge of making laws. Those people are elected, by the way, and whatever laws they make, we follow them until a court says that those laws are illegal or unconstitutional, or we elect different people who make different laws. That's how a modern civil democratic society works. So I don't believe in disobeying laws, and that includes public health laws. So yes, you can demonstrate downtown. No, you cannot break public health orders.
All right, we have India, followed by Raina.
All right, I think this question will also go to Dr. Pizzino. We haven't heard much about nursing homes locally in recent weeks. I was wondering if you have heard of any potential problems stemming from nursing homes in Shawnee County.
Yeah, thank you for your question, because it really gives me an opportunity to give a big shout out to our nursing homes and their staff. They have been incredibly awesome. I have nothing but good things to tell you about our nursing homes. Since the beginning, we realized that nursing homes were definitely a very risky situation. And we appointed inside the health department a nursing home or long-term care facility coordinator, not just nursing homes. That includes rehab centers and homes for people with disabilities and so on. And we have had regular conference calls with them. We have listened to what they need. We have facilitated the provision of personal protective equipment for their staff. We have made sure that they were implementing all the national standards and recommendations issued by Center for Medicaid and Medicare, CMS, or from the CDC. And as a result, to date, we have been spared any major outbreak in nursing homes. We have had sporadic cases, and those were aggressively investigated, and so far they have been contained. So there is really no outbreak in any nursing home in the county right now. That is an incredible result. In part, it's luck. Again, I don't want to be one of those people who take credit for everything good that's happening in our county. In part, it's luck. I'm sure that where those outbreaks occurred, in some cases, people were doing all the right things, and it just so happens, like that elderly couple I told you about a moment ago that did all the right things and they still got infected. At least one of them got infected. So in part, it's just luck, but in part it's because they have done an awesome job, work really hard. So once again, it's not time to put down our guards. And I hope the nursing home, I'm confident, I'm sure the nursing homes will continue to keep up their precautions. I know it's very hard for families when they're told you can't go and visit your dear one, your loved one, and it's particularly heartbreaking when people are near the end of their lives, and there are still restrictions on how many people can be admitted as visitors to say, in some cases, the last goodbye. Just I can't even imagine how that must feel. But I know that without those measures, most probably we would have seen more sick people in nursing homes and more people dying.
Next, we'll have Raina.
This one is either for Dr. Pacino, Mayor de la Isla, or even Dusty. We kind of touching on the mask issue. We've seen some incidents across the country of employees at mainly grocery stores, smaller grocery stores, being subject to hostility from customers, sometimes in extreme cases, even violence. Is this something, and a lot of it has stemmed from the requirement to wear a face mask upon entry to these stores. Is that something that has been on your guys' radar? Is that, kind of come up in the back of your mind as a potential concern? Obviously, as we mentioned, we're entering the reopening phase, and some people are not really feeling the need to adhere to these safety guidelines and things like that.
For me, yes. Sorry about my camera. It's all messed up for some reason. But absolutely, it's been something I've been watching since the beginning of this. I saw the report. I think it was in Texas. I'm not sure it was. The security guard told somebody that they couldn't come in without the mask, and those people ended up killing him right there. I don't understand it. It's something we can't directly control. I think going back to what Dr. Pacino said, it's unacceptable to not follow laws and rules and regulations. And those organizations that are requiring people to wear masks as they go into the store, they have every right to do that. It's the same as any other business has the right to. I almost equate it to the no shirt, no shoes, no service kind of rule. And I think it's disturbing, sad, and every other kind of negative word to think that people can control others with violence or anything like that. So it is on our radar. I hope it doesn't happen here, and I can only do so much. We can only do so much to control that.
Okay, I don't see any other questions, so thank you all for attending. We'll have another news conference next week on Friday at the same time. Have a good weekend.